Hi, I'm Kevin. I'm a third-year medical resident, and today we're going to talk about a mysterious case of Cindy. Cindy is a 22-year-old university student who's super healthy, not on any medication. She went on a camping trip with her friends somewhere in the mountains. They did what happy campers do. They had fresh water from the river, and they played around and made their own campfire and had good food. They had a good time. 2 days later, she developed, as well as all her friends, some nausea, vomiting, and diarrhea. She was in a lot of pain, so she went to her doctor. Thankfully, once she was at the doctor's appointment, she looked good, she was eating well, drinking well, and her exam wasn't too serious. So her doctor recommended that she make sure she drinks a lot of water and take a few days off. It took a couple more days for the diarrhea to stop, but she was able to get better eventually. Fast forward 4 weeks. She was in class, it was close to her exam seasons. One day she felt kind of weak. Strange, and it's not just like a normal fatigue, but she felt a little bit weak, especially in her legs. She didn't think much of it because her final exam is coming up and she's got to make it to class. And she did for the first day. The next day, she started feeling even weaker. Her weakness is now not just in the leg, and she could feel it in her thigh as well. She's really having trouble picking up her legs, and they feel super heavy. She told her friend, who suggested that she make an appointment with her doctor right away. So she did, but unfortunately, there was no appointment until the day after. So she waited and she went to class. The third day, she started feeling even weaker. Now she could barely move her leg and she's starting to feel a little bit weak in her arms as well. So she freaked out. She immediately called her friend who drove her straight to the emergency department. After waiting for a few hours, doctors were finally able to see her and they knew immediately something was wrong. She could barely move her legs. Usually when we look at power of limbs and strength, 3 is when you can lift up your leg against gravity, meaning holding it in the air. She could barely do that. If you lift, the doctor tried to lift up her leg and it dropped straight to the table. What's even more shocking is when they knocked her knee to elicit a reflex in her knee, there was nothing. So the doctors knew immediately something was wrong. They ordered large amount of investigation. They tested her blood for any vitamin deficiency, autoimmune problem. They scanned her brain and her spine just in case there's infection or something else going on there. They also did a lumbar puncture in her back to test the spinal fluids to see what's going on. What are we trying to find? There are many things that can cause the symptoms she's having. And we found that even though she's very weak in her legs and also her hands and arms, she didn't have any reflex. Her sensation are actually normal. So she could feel pain, temperature, and even vibration. So this is an isolated motor deficit. And there are many things that can cause it. Vitamins can cause it, but usually when you have vitamin B12 deficiency, we're thinking about cerebellar, you might have balance issues, not so much motor weakness per se. We're also worried about infection or stroke causing this symptom. So we scanned the brain, making sure there's no infection of the brain like encephalitis, making sure there's no stroke. Sometimes spinal problems can cause it as well. Transverse myelitis is one, poliomyelitis, and sometimes tick bites from people who are camping can cause symptoms as such. Lyme disease as well. It could be nerve problems, it could be demyelinating problems, or the junctions of it can cause problems too, such as myasthenia gravis or botulinum. It's from the Botox injections that you get as well. You're blocking that junction and the firing of the neurotransmitters. Or it could be the problem with the muscles itself. So we did all these tests to figure out what's going on. Finally, her labs came back. Her white cells are normal, making infection and inflammation less likely. Her autoimmune screening was negative, and her vitamins appeared to be normal as well. We didn't find any electrolyte changes that can explain what's going on. Her MRI of her brain was negative for any stroke, and her spine looked good too. Finally, when we got to the spinal fluids that we got from the lumbar puncture, we saw what we needed to make a diagnosis. She had very high proteins, but normal white blood cells. And we often see that in a condition called Guillain-Barré syndrome. Guillain-Barré syndrome is a very rare condition that happens in 1 in 100,000 people. It is very serious. It is where your body mistakes the coating of your nerves called myelin, which you can think of as an insulator of an electric wire, as the enemy, and it attacks itself. Often this syndrome is preceded by an infection, either respiratory or gastrointestinal. About 4 weeks ago, just like what happened to our friend Cindy, who went to a camping trip and had a diarrheal illness. Her body recognized these bacteria as the coating of her nerves and ended up attacking it, causing her motor weakness at this time. And this is a serious condition that usually presents with weakness starting from the most distal, so most further away muscle groups, and it travels up, called an ascending weakness. So it starts with her legs and it goes up to her hands and up to her arms. And these can be very dangerous because once it gets to your lungs and your upper airways, you can have paralysis and you can stop breathing. These can kill you. Thankfully for Cindy, she got into the hospital pretty early on, so the doctors were able to recognize what she has and start treatment. And what are the treatment available? Treatments include IVIG or IV immunoglobulins. Think of these like a pool of good antibodies that could outcompete these bad antibodies that is attacking her nerves. We're trying to give her more and flush out all the system and outcompete. The second way is through plasmapheresis. Think of this like a blood filter. You're trying to filter out all the bad antibodies so that she doesn't have so much that's causing damage to her body. These can take time to work, sometimes days, sometimes weeks. But if you do it early enough, it could help. In the case of Cindy, it took a few days for her to feel a little bit better. Her symptoms stopped progressing, and it took her a few days to start gaining a little bit more strength in her arm. Treatment of GBS is followed by a long course of physical therapy to get them feeling stronger again. But a large proportion of them do. So thankfully, it is curative. Anyways, that's the end of this. I hope you enjoyed it. Tell me the truth. Were you surprised by this case? What do you think?